Okay, so now we are going to do the uterine tubes. They are also very commonly called fallopian tubes or oviducts. Their job is really to take an ovulated oocyte or egg or ovum and take it into the tube. Fertilization generally occurs in the tube. And then if fertilization occurs, then the embryo, well, it'll start developing to become an embryo. And then the tube escorts it down to the uterus where implantation could occur. So the uterine tubes have kind of a strange course. So remember, you're looking at a posterior view here, and the uterine tubes are around back, so they're like back here. And they go lateral to medial. Remember, it doesn't directly attach to the ovary. And they have double functionality. This is the site that fertilization generally occurs, and it usually occurs right here in this yellow portion called the ampulla. And then the egg, if it's not fertilized, or the embryo, if it is, moves through the uterine tubes to the uterus, where it might be implanted, or if it's not fertilized, then it would move out of the cervix, right, into the vagina, and it would be expelled that way. Okay, so let's look at the tube from a mid-sagittal section. Starts here, wraps around, and goes that direction. All right, so let's look at this in more detail. Where are you? Okay, so tissue layers. The outer layer is covered with visceral peritoneum. And there's a middle layer, and the middle layer is made of smooth muscle. It's called the myometrium or muscularis layer. And then the inner layer, we learned way back at the beginning of the semester, is ciliated simple columnar epithelium. Can't really see it, that it's ciliated here, but it is ciliated. And that is for the courting of the oocyte that we talked about before. All right, so the parts, this portion right here that folds over the ovary. The hand portion is called the ampulla, and the fingers are called the fimbriae, which actually means fingers. These are like projections that like fold and drape over the ovary, especially when your progesterone levels are high. Those will fold over. And then this big white portion here, right, wide portion, infundibulum with fimbriae, and then ampulla is the portion that curves, like this portion. So if this was my ovary, then this portion right here is the ampulla. And then the isthmus right here you're seeing in green, and then this narrow portion right here is actually called the uterine part. And it ends, the uterine tube or fallopian tube or whatever, ends medially close to the superior surface of the uterus. Now, a tiny bit about courting of the oocyte. When ovulation is occurring or is about to occur, the infundibulum and the fimbriae bend to cover the ovary, and then these stiffen, and the cilia lining everything starts to beat, and the smooth muscle starts to contract. The ciliated cells and the smooth muscle activity will bring, hopefully, the oocyte into the oviduct or tube. Okay, a little bit about pelvic inflammatory disease and ectopic or tubal pregnancies. These are important things for women to know to take care of their reproductive health. Pelvic inflammatory disease, often abbreviated PID, quite often starts with some kind of infection or irritation in the vagina. And FYI, it does not have to be a sexually transmitted infection, although sexually transmitted infections are pretty likely to cause PID if they're not treated. They don't all cause this. So how this travels is that some infection gets into the vagina, and it could, by the way, have been some digestive pathogen from wiping inappropriately, or some other pathogen that moved from the urinary tract into the vaginal canal because of UTI. So it will move from here, from the vagina up past the cervix into the uterus, potentially into the tubes. And because the tubes are relatively narrow to begin with, scarring, inflammation, this can cause infertility very quickly. So one of the reasons why a sexually active woman should be careful about exposure to pathogens is because a lot of times this is asymptomatic, but can cause fertility issues down the line. So the only reason to use condoms is not just to avoid pregnancy, it's to also protect your future reproductive health in case, of course, you might want to have a pregnancy later. Okay, and then associated often with pelvic inflammatory disease is, like I said, infertility, or if you scarred or damaged this tube, you could get what's called an ectopic pregnancy. Ectopic means out of place. The most common place that they occur, well, they should occur. Of course, the implantation should occur in the uterus. But if this tube is blocked and fertilization can happen out here, then quite often what could occur is implantation could occur in the tube. And this is really, really dangerous. Implantation occurs outside of the uterus. The most common site is the tube, okay? And so what would happen in a woman is that you would have a positive pregnancy test, but when you went in to look, for instance, there would be no visible pregnancy actually in the uterus. And a lot of times there's abdominal pain, abnormal vaginal bleeding, and tubal pregnancies can't be carried to term. And if a woman tries to carry them to term, it's really dangerous for her. So a lot of times what they have to do is terminate that fertilization and implantation. They have to remove it, and they can remove it either chemically or they can remove it surgically. And these, again, are far more likely with pelvic inflammatory disease.